The Rapid Rhino nasal tamponade devices are specifically designed to address the major challenges in the management of epistaxis. This device features a high-volume, low-pressure tamponade, ensuring gentle and even compression to control epistaxis at the source of the bleed. Water activates the carboxymethylcellulose, turning the dry fabric into a slick and cooling gel for ease of insertion. Remove the device from the envelope package along with removal of the light blue plastic tube encasing. Thoroughly saturate the Rapid Rhino nasal tamponade in sterile water by submerging the product for at least a full 30 seconds. Insert the Rapid Rhino nasal tamponade into the patient's nostril parallel to the septal floor or following along the superior aspect of the hard palate. If there seems to be some resistance upon insertion, simply remove and reinsert, ensuring the device is positioned such that it is pushed into the face level to the palate, as opposed to up the nose at a 45-degree angle. Gently insert the device until the blue indicator ring is just inside the opening of the nostril. Using a 20 cc syringe, slowly inflate the balloon with air only inside the patient's nose. The balloon will conform to the nasal anatomy. The Rapid Rhino nasal tamponade uses gentle pressure to control intranasal hemorrhage at its source, while the plant-based CMC gel creates a moist and comfortable environment. Use the pilot cuff as you would on an endotracheal tube to monitor intranasal pressure as you inflate. It should be taut but not hard. The specific amount of air to inflate will depend on the specific anatomy of each patient, so be sure to use the pilot cuff to monitor. When there is sufficient pressure, allow the patient to sit for 15 to 20 minutes prior to discharge. Swelling in the nasal anatomy will reduce, and the balloon may need to be inflated more to avoid movement of the device. After the second assessment of the pilot cuff, tape the plastic butterfly to the patient's cheek for discharge. The patient may come back 24 to 72 hours later for removal of the device, or they may see an ENT specialist for follow-up. Rapid Rhino has a unique design that will control epistaxis the first time and is more comfortable for patients upon insertion and removal than other packing options.